So just to quickly introduce, today's session is about how AI and modern technology are improving patient satisfaction, and our speaker is Jose Garcia. So let's start with our first question for tonight. So from your perspective, what are the biggest gaps in patient satisfaction today, and where do you see AI making a real difference?
I think when I spend a lot of time on LinkedIn, people are talking about health AI, they're talking about how it's going to fit in to workflows. But, you know, I had a speaker on a webinar in January, and he said, according to their internal data, 70% of the usage is happening outside of hours when there's no clinician available. And people
Mhm.
are talking about that. And I think when you talk, and with your question, what are the biggest dissatisfactions is what happens between meetings? What happens
Right.
between meetings? So, especially if a patient is being passed from one department to another in a healthcare system, it's that
Mhm.
transition period where the dissatisfaction or the wait time and accessing services. So it's like a lot of people think about AI versus doctors, but actually AI
Mhm.
is competing with nothing. The
Right.
biggest competition is no service. There's no
Right.
doctor available. They're waiting. There's no one answering the phone. And that's what people need to be thinking of. And that's where AI can provide its value because AI is there to help people when there's no one answering the phone, when the doctor isn't in. And
Right.
obviously, people are very focused on AI scribes and clinical workflows and all that stuff. And that's all very important. But people don't think, I think people are focused on that 30% and they're not focusing enough on that 70%. And that's also
Right.
where you can benefit the health of the whole population is in that
Right.
70% gap, which is where there's a big opportunity for health AI. And that's where a lot of people are dissatisfied. So I think you're going to be hearing more and more about that.
Absolutely. Thanks for sharing views on that. The second question is, how can AI help personalize healthcare experiences while still maintaining the human touch?
I think, and I was in the preface to this conversation, I think one is empowering the doctors
Hmm.
to identify the relevant research that's going to benefit that patient based on their medical history to where they are right now. So, for instance, I'll give you an example. Um, Somebody who has a certain type of cancer, um, they're going to the doctor, they're being prescribed drugs, they're being prescribed chemotherapy, they're getting a generic dose of those drugs, and they might have a specialized subtype. They might have something different about their medical history. That dosage may be too high
Right.
of that chemotherapy. They might be having very bad side effects. AI is going to help the doctors say to personalize the dosage of those, not so much for that drug, a lower dose, or maybe a different treatment option, to personalize the treatment based on their medical history. And that also enables a doctor to focus on that person in front of them. And the
Right.
AI is giving them the relevant information to personalize that treatment. And I think that's now I'm using cancer
Yeah.
and I think that's because that's a low hanging fruit. I think this is going to be true for a lot of diseases. A lot of diseases are rare. A lot of
Yeah.
people, like we've lumped them, like we were talking earlier about lung cancer. Everyone thinks it's
Hmm.
a common cancer. No, it turns out it's 25 rare diseases that we've actually
Hmm.
bracketed together. AI can break up these diseases into their subtypes so we can personalize. And it's going to happen for all types of care.
Right.
It's empowering the clinicians to give with those recommendations.
So
And
it would fit in as an ambient system where a lot it would help in decision making in a lot of processes where it doesn't kill the human touch, but it kind of enhances it. It saves the clinician time, but without breaking the relationship between the clinician and the patient.
yeah, And I think it's also going to really help the patients with their dosage. And I think also and not just ambient, but also decision support before and after the meeting
Right,
with the patient. And because a lot of times the doctors will need, they have 1 or 2 minutes before the patient walks in the door.
right,
They've got 1 or 2 minutes. The patients, and how the AI can help them, can make the most of that 1 or 2 minutes before this person is about to walk into this door, and here's a list of recommendations. As
right,
opposed to this antiquated IT system where they're just paging through a database. You know,
right.
um, so because I think when people think about ambient, they think about when the doctor and the patient are together. But there's those 1 or 2 minutes before and after that are also
Right.
very important too.
Absolutely. So, leading to my next questions, we already spoke about a specific operational bottleneck that the challenge is when people are not able to access care, and like 70% of the population is stuck in that area where it's either in between appointments or for whatever reason they have not been able to get to a clinician. So, in these kind of operational bottlenecks, how do you see AI helping solve them?
I think actually the biggest value. Um, it's difficult for me to comment on operational bottlenecks. To be honest
Mhm.
with you,
Right,
I think really you need
right.
a nurse who understands all these workarounds that aren't in the org chart.
Right.
Um, but I'm gonna twist your question, Indranil. I hope you don't
Yeah,
mind.
no
I
worries.
think the most important, one of the lowest hanging fruit is population health.
Right.
Population health, not necessarily direct to consumer healthcare, the entire population. And this is actually something that AI is really well suited for.
Hmm.
I'm not too sure how it's going to be done operationally. This
Right.
I don't know, but I know this is something that's badly needed, and because of the venture capital driven ecosystem,
Hmm.
and it's just been underdeveloped with
Right.
health AI.
And
So
also in United States, it's majorly privatized, right? Like you mentioned, because of venture capitalists. But in say UK and a lot of Europe, it's all driven through NHS, so it's a public health system. So
it's even more complicated than
yeah,
that, Intranel.
yeah,
Then, like in the UK, you have the NHS. In Spain,
right,
hello, you've got 12 health systems plus a
right,
private insurance system. And then in Europe, and then you have it's Europe is very complicated, but it's
right,
generally public. But most
right.
European countries don't have something like the NHS. They don't
Hmm.
really, they have it's a bit more complicated than that. They have a combination of private insurance and public institutions, and a lot of it's very regional as well. So this is really difficult for people working in digital health, because then you'll have European regulations, state level regulations, and then sub subnational regulations.
Right.
Um, I don't have any advice on how to navigate that, I'm afraid.
Yes, yes, that's one of the complications in the system, I guess.
Yeah.
Yeah. So I think we spoke briefly about where we see AI-driven solution helping reduce patient frustration, especially in areas of wait time or follow-up care or in between consultations, procedures, and things like that. So just wanted to get to know a little bit more about your thoughts on that. And for example, that care is also not being received by the patients, I am guessing, because of either shortage of manpower or budget shortages or something like that. So that care gap, how do you see AI fulfilling it? Is AI going to be much more economical in the future? Because currently, yeah, I mean, if you compare it with clinicians, it is probably more affordable. But if you compare it with entry-level administrators, it is more or less on a similar cost. So they're not able to handle so many documentations or so many this. So even if they are to do it with AI, yeah, it would be automated, it would be in a streamlined process. But what about the cost factor?
Also, it's very interesting is the as well as people when they're accessing AI,
Yeah,
they don't they might use health AI. They might actually want something slightly different than they would
right.
from a healthcare practitioner. So, for instance, a lot of the mental health apps, the people are asking mental health questions and financial questions at the same time.
Right.
But it's like a mental health practitioner says, no, no, we only do mental health. We don't do your finances. But then the people are accessing it by AI. Well, I don't care. This is my problem. It's mental
Right.
health and financial, right?
It's causing my mental.
Yeah. So they're combining it. So people
Right.
like, well, so when people are accessing it by AI, they're like, well, this is my problem. I'm so now that I'm going by this AI route, I want it solved in a different way. And then I might be framing it differently. But I think, I personally think a lot of this innovation is going to be driven by direct to consumer. And also, we were talking about how do you get inside these health systems. There's something we haven't mentioned is
Right.
the back door into healthcare, which is on the clinician's cell phones. And this is
Hmm.
how a lot of AI is being deployed into healthcare right now. It's the clinician walks into the hospital with a mobile phone in their pocket. And if they've got AI apps on their phone and they're not mandated by the health system, but they're using the AI apps in healthcare. So this isn't like the back door into healthcare,
Right.
it's like the back pocket into
Right.
healthcare. And this is how a lot of AI apps are being used in healthcare. They're not sanctioned. They're going
Right.
they're going in through the back pocket. So, and I think this is different than previous waves of digital transformation in healthcare, where you had I mean, you had to
Very
have
centralized
institutional
approach.
buy-in.
Right.
Um, but I'm not too sure if I answered your question. I'm kind of wiggled sideways there, Indranil.
Oh, that's absolutely fine. But thank you for sharing your views on that. So, coming on to our last question for today, which is what AI-driven innovations? I mean, you've been speaking to a lot of different kind of innovators, investors who are also dealing with other kinds of innovations. So, what kind of AI-driven innovations in healthcare excites you the most when thinking about the future of patient care?
I actually think two things, and I don't know, these aren't use cases, modality. What I'm most excited about is direct to consumer preventative
Hmm.
health. That's what I'm personally most excited about. Is I want I want to be in charge of my own health, and a lot of people do. Like
Right.
if you've got like a health problem that is coming, you
Yeah.
don't need surgery yet, you don't need
Yeah.
medication yet, right?
Yeah.
Don't go to a doctor. Don't
Yeah.
go to a doctor. You don't want to go to a doctor. I want an
Right.
AI app that's going to
Right.
help me prevent and because you don't want to go into the health system if you're
Ab-
subclinical. You don't want that
Absolutely.
because
Absolutely.
it's a nightmare. You get I had an issue. I won't go into it, but I was going past and past and past and past. Just 4 months. I was going back and forth like a ping pong ball, and I'm like, oh, I could just do this on AI in 5 minutes. I did. I went on Claude, and it's Claude, I went on another AI app, and it's like, oh, at least I got my answers. I didn't have to wait 4 months. So this is very exciting. And the other exciting that excites me is population health support. And I don't know how that's going to work.
Right.
I think those are the things that are going to have the biggest impact on people's health.
Absolutely. Very interesting. Like preventive health for me also personally is something that I resonate with a lot. And I also believe that whatever can be handled before and without medications or medical procedures is probably the best way to maintain your health.
Absolutely.
So that is very interesting. All right. Thanks, Jose, for your time and sharing all your views on this topic. It was great to hear your perspective.
Thank you so much.